For more anatomy related videos, please subscribe to my channel, Learn with Dr. Tanya Hashik.
Hello everyone, let us start this video with a positive quote. So today's quote is, the best way to predict future is to create it. So let us start creating it. So today's topic of discussion is duodenum. So duodenum, it is a part of small intestine. It is the most fixed part of the small intestine. We will discuss more about it today. Duodenum, it is the most shortest, smallest and the most fixed part of the small intestine. So it is curved around the head of the pancreas. So this is the pancreas and it is curved around the head of the pancreas in the form of C. That is in the form of the letter C. And it can be divided into 4 parts. So the top part, this is the superior part, and this part, it is the descending part. This is the horizontal part and this is the ascending part. So duodenum, it can be divided in 4 parts. They are the superior part, the descending part, the horizontal part and the ascending part. And it is seen at the level of L1, L2, L3 vertebra. So it is seen opposite to the L1, L2 and L3 vertebra. In total, it is about 25 centimeter long. It starts at the pylorus and it ends at the duodenojejunal flexure. So first part, it is the superior part. It is about 5 centimeter long. Next is the descending part. It is about 7.5 centimeter long. The horizontal part, which is about 10 centimeter long, and next is the ascending part, which is about 2.5 centimeter long. So we'll discuss each of these part in detail. So today we'll only discuss about the first and the second part of the duodenum and its relations. So duodenum, it is a retroperitoneal organ. So what do you mean by retroperitoneal organ? It is present behind the peritoneum. So the duodenum, it is present behind the peritoneum, and most of the duodenum, it is fixed and it is only free or mobile only at the 2 ends. So first we will discuss about the superior part of the duodenum. So the superior part of the duodenum, it is only about 5 centimeter long. So it begins at the pylorus and it passes backwards, upwards and to the right and continues with the superior duodenal flexure. So this is the superior duodenal flexure and this is the inferior duodenal flexure. So the superior part of the duodenum, it continues with the superior duodenal flexure. So now we will discuss about the peritoneal relation of the superior duodenum. So the proximal 2.5 centimeter. So this is the proximal 2.5 centimeter and this is the distal 2.5 centimeter. We have already discussed that the 2 ends of the duodenum, it is mobile. So the proximal 2.5 centimeter of the superior part of the duodenum, it is mobile and it is attached to the lesser omentum above and to the greater omentum below. So it is attached to the lesser omentum above and to the greater omentum below. Next is the distal 2.5 centimeter. So this part, the distal 2.5 centimeter, it is fixed and it is retroperitoneal. So it is seen behind the peritoneum. That is, it is covered by a layer of peritoneum on the anterior part. Now we will discuss the visceral relations of the duodenum. That is the superior part of the duodenum. So this is a sagittal section showing the side view. So this is the anterior part. So this is the lumen of the duodenum and this is the anterior part and this is the posterior part and this is the superior and this is the inferior relations. So anteriorly you can see the quadrate lobe of the liver and also the gallbladder. Here you cannot see that. So this is the quadrate lobe of the liver and posteriorly there is a bile duct. So this is a bile duct and next you can see the gastroduodenal artery. So this is the gastroduodenal artery and also you can see the portal vein. So these are the posterior relations. So you can see the bile duct, the gastroduodenal artery, and also the portal vein. So these are the posterior relation. And superiorly, you can see the epiploic foramen. And inferiorly, there is a head and neck of the pancreas. So these are the relations. So this is the head and neck of the pancreas, and this is the first part of the duodenum. So inferiorly, there is the head and neck of the pancreas. So these are the visceral relation of the first part of the duodenum. So now we will discuss about the second part of the duodenum. So this is the second part of the duodenum. It is the descending part of the duodenum. It starts at the superior duodenal flexure. So this is the superior duodenal flexure, and it passes downwards and it reaches the inferior border of the third lumbar vertebra, and at the inferior border of the third lumbar vertebra it curves and it becomes continued with the third part of the duodenum at the inferior duodenal flexure. So it starts at the superior duodenal flexure and it passes downwards, and at the lower border of the third lumbar vertebra it curves to the left side and it becomes continuous with the third part of the duodenum, that is the horizontal part at the inferior duodenal flexure. And this part of the duodenum, it is about 7.5 centimeter long. So this part of the duodenum, it is retroperitoneal as well as it is fixed. So its anterior surface, it is covered by peritoneum except at the middle part, which is in direct contact with the colon. So it is a retroperitoneal part of the duodenum. That is the anterior part, it is covered by peritoneum except at the middle, which is in direct contact with the colon. Now we will discuss about the visceral relations. So the second part of the duodenum, it has both posterior as well as anterior relations. So anterior relations are these structures. So this is the duodenum. You cannot see it clearly because it is seen posterior to these structures. So liver, gallbladder, transverse mesocolon, transverse colon, loop of small intestine. So these are the structures which are seen anterior to the second part of the duodenum. So this is the duodenum. So the anterior relations are the liver, the transverse colon, transverse mesocolon, the loop of small intestine, gallbladder. So these are the anterior relations. So next is the posterior relations. So in this figure you can see the posterior relation. So this is the duodenum and these are the structure which are seen posteriorly. So there is the right kidney and also the right renal vessels and also the right part of the inferior vena cava and also the right psoas major. So these are the posterior relations. So next is the medial as well as the lateral relations. So medially there is the head of the pancreas. So this is the second part of the duodenum. Medially there is the head of the pancreas as well as the bile duct. You cannot see that. So there is a head of pancreas as well as the bile duct, and laterally there is a right colic flexure and laterally there is the right colic flexure. So these are the relations of the second part of the duodenum. So today we discussed about duodenum. So duodenum, it is the most fixed and the widest part of the small intestine, and it is about 25 centimeter long, and it is divided into 4 parts, and the 4 parts of the duodenum are the superior part, the descending part, the horizontal part and the ascending part. And the superior part, it is about 5 centimeter long, the descending part, it is about 7.5 centimeter long, and the horizontal part, it is about 10 centimeter long, and the ascending part, it is only about 2.5 centimeter long. And then we discussed about the relations of the superior part of the duodenum, and then we discussed about the relations of the descending part of the duodenum. So We'll discuss about the horizontal as well as the ascending part of the duodenum, as well as the blood supply, nerve supply, lymphatics, etc. in the next class. So this is the end of today's video.
This is the end of today's video. For more videos, please subscribe to my channel and press the bell icon.